Now, City Power has already started to exclude certain hospitals and clinics in Johannesburg from load shedding. This, of course, due to the challenges these facilities go through during the blackouts. For more on this story, we're joined by City Power spokesperson Isaac Mangena. A very good morning to you. We must now imagine that a lot of preparation will be needed on your end to ensure that the health facilities are exempt from load shedding and continue to function as normal.
Yes, indeed. We can confirm that we basically were in touch with the Department of Health to basically find ways to exempt them from load shedding so that they can be able to provide the service, the very important service of saving lives as the hospitals and their facilities. So we have, as City Power, obviously looked at our capacity to see if we are able to exclude, and that we have already started excluding some of those health facilities. About 10 of them in the city of Johannesburg that are supplied by City Power have been exempted from this past weekend, and we're looking at ways to basically ensure that we exclude most of those that are remaining behind. We've got about 187 health facilities within the city of Johannesburg, including the clinics and the hospitals that were presented to us to look at ways to basically exclude them from load shedding, and that's basically what we are doing at City Power.
Which are some of those hospitals that are already on that list and will not experience load shedding from this weekend?
Some of those hospitals include Helen Joseph's, Coronation Hospital, Baragwanath Hospital as well, and also Charlotte Maxeke, among others, that we will basically ensure that in fact, we have already started. As you know, load shedding is upon us even currently. So when we do have those stages kicking in those blocks where the hospitals and the clinics are, they won't be affected by this load shedding. But as I mentioned, we are basically looking at ways to ensure that we exclude all of this, or most of them at least, from load shedding, especially because of the essential service that they are providing to the residents of the city of Johannesburg.
So what processes will be needed on your end to ensure that the preparation is well underway and that you keep adding to that list of health facilities?
So basically what we are going to do, or we have already started doing, is to look at the configurations of our network. So most of these facilities, especially those that we are not able to exclude currently, they are embedded within the blocks, whereby you've got a lot of customers. If we are to exclude those facilities, it means that a lot of what Eskom is requesting when they go on load shedding will not be met by City Power. So what we're trying to do basically is to look at the network and reconfigure it in a way that we will exclude the health facilities from the residential and business customers, so that when we switch off, we don't switch off the hospitals, but we can switch off other customers. I'll give an example with the problem that we have at Rahima Musa, whereby if we are excluding them, it means the whole of West Dean and the surrounding areas will be excluded, and that is about 34 MVA, which is a lot to basically not include as part of the load shedding schedule. And if we are going to basically try to exclude those, it means that we won't be able to meet the threshold that Eskom is requiring to ensure that we satisfy their capacity requirement. So we are looking at those kind of situations to ensure that we can be able to separate the hospital itself from the rest of the residents. But also it's also an issue of resources in terms of the human resources, because currently if we are to basically exclude everyone, it means we have to make available operators who are really in short supply at City Power to move around physically to go and ensure that the hospitals are on while the rest of the community around those hospitals are off. So that is a huge toll on us in terms of our resources, and that's another one that we're actually looking at to see how we can do that. But it's also not about just taking people to those facilities, but it's also about the safety of the switching on and off. That's why we are trying to do it remotely. But doing it remotely, it means when we exclude certain hospitals, we have to exclude the rest of the suburbs or the townships where those hospitals are, and that is not really viable for us at this current moment.
So with that challenge in mind, will these considerations be made each time that there's load shedding to ensure that it's something that's consistent and sustainable each time there is load shedding under those selected health facilities?
Yeah, currently those 10 don't have a problem. So it's just the other facilities, especially in areas like Alexandra and other net care facilities that we are not able to exclude from load shedding. But we are obviously talking to the management of those facilities to assist them, especially where we can, because according to the law, these facilities should actually have capacity, internal capacity to kick in whenever there is load shedding, whenever there is unplanned or even planned outages, because even when there's no load shedding, sometimes there could be a trip at the substation, or there could be a fire at the substation, or there could be a cable theft that affects supply to that facility. So it means that facility at that moment, even ourselves, we cannot help them. So they need to basically ensure that they invest in internal capacity, they invest in generators and other facilities that they can basically kick in whenever we've got problems with dealing with them. So we are talking to all those customers, because they're still our customers as City Power, to ensure that they can be assisted whenever there is a problem with electricity. And one of the things that we are also looking at doing going forward, especially with the onboarding of the IPPs, is to ensure that some of the solutions that we're looking at, including the solar systems and gas systems, when they come through, we also prioritize those facilities like the hospitals and the clinics, so that whenever there is a problem of capacity with Eskom and we are forced into load shedding, those facilities, they still have alternatives to ensure that they can keep on running and saving lives.
And before we let you go, Isaac, how are you planning then to, make sure that you tackle the loopholes that you make mention of, the capacity issues and the safety issues that come with ensuring that this system is effectively managed?
Our human resource department has already started with recruitment of more operators and the training of more operators to ensure that whenever because remember, even before we hadn't planned for load shedding, and now because we have realized that it's actually going to be with us forever, we had already started with programs to basically train more operators, recruit more operators from the market, so that we are able to deal with the physical switching on and off of during load shedding. So that's basically what we have been doing internally. But however, we're also looking at ways to reconfigure our network so that we are able to switch on and off remotely and still be able to exclude some more of those facilities that I've mentioned that we're not able to exclude currently. And as the minister also indicated, it will be an ongoing job that we are going to do as the service provider within the city of Johannesburg to ensure that we gradually move towards at least the middle of the number of facilities that are available in the city of Johannesburg that will not be load shed during load shedding.
Very well. Thank you so much for that update.